Good morning, I guess. Welcome to the Mason County Board of Health meeting for March 24, 2026. I'm Eric Nisco, City of Shelton Councilman and Chair this year. Go around the table.
I'm Mark Wilhelm, one of the new Board of Health members.
And I'm Peggy Van Buskert, and I'm representing Hospital District 2.
Sharon Trask, Mason County Commissioner, District 3.
Randy Dillon, Mason County Commissioner, District 1.
Dave Wyndham, Director, Mason County Public Health and Human Services.
All right, online.
Matt Torsville, Mason County Commissioner.
Is there anything else?
And you got from the tribe?
Steve. Oh, yeah.
You got Steve Prager and Sneda. We got another Board of Health member here in the bottom right hand corner. And from the tribe? And she's muted, but
All right.
okay.
Well, we do have a quorum.
Yes.
Yep.
All right. Has everyone read the action agenda and there's a motion to approve?
I make a motion we approve the agenda as presented.
I'll second.
Motion and second to approve the action agenda. All in favor say aye.
Aye.
Motion carries.
Approval of the
Sorry.
agenda, not the action.
I'm Spacey. Has everyone had a chance to read their minutes?
Yes.
Is there a motion to approve the minutes for January 27th?
So moved.
Second?
All right, motion and second to approve the minutes from January 22nd. All in favor say aye.
Aye.
Aye. Motion carries. All right, we have a report from the health officer, Dr. Steve Krager.
Everyone, hope spring is treating well. I have a couple updates to share. So we met in January, and one of my main updates was about measles, as we've just been starting to see some cases across Washington. And we've been seeing a lot of cases just across the country in general. I have some, good news, bad news that I'm going to update, talk a little bit about measles, and then talk about something called the Rural Health Initiative, which is a funding opportunity from the federal government that the state has that might be relevant to us in Mason County. So just want to touch on that real quickly. So I think when we talked last, we had a few cases in Snohomish County. They declared an outbreak, which, again, I think we talked about definition of an outbreak at that time. It just means that essentially that we've seen some transmission occur locally. Snohomish continued to have a few kind of sporadic cases over the last month after January. But they have been at 14 cases and kind of seem to be staying there for the last month. So I think their outbreak is probably going to be declared over soon, but we'll just wait and see. But we continue to kind of have sporadic cases in different counties. Most recently, 2 cases in Grant County a week ago. They were, I believe, exposed out of state, and then but one of those cases had to be hospitalized as a young child, and that was our first hospitalization from measles across the state. One of the things I've noted as we again kind of just have more measles in general, and thankfully this doesn't happen in Mason County, but I've seen it happen in other counties, is just, even if a county doesn't have a case, they often have residents who were exposed to a case. So a resident was around someone who was infectious with measles, and then that still creates a lot of work for even a county that doesn't have an actual case. They still have to investigate those residents. When I say investigate, I mean essentially reach out and try to figure out if they're immune to measles or not. Have they had measles previously? Do they have titers, or do they have evidence of vaccination? And that kind of determines whether we, ask them to quarantine and stay away from other people, or if they're considered immune, but continue to watch for symptoms, but we don't ask people to quarantine. My point is, even without a case in a county, it still creates kind of a burden of work for public health to follow up on those people who were exposed. Oftentimes, it's people in a waiting room for an ER. A lot of times, unfortunately, measles is still, it's obviously on people's radar, but people still miss it. So again, the rash that can present with measles can look a lot like other rashes that kids get from other viruses. So sometimes it takes a visit or two that I've seen where, a kid will go to the ER, they get sent home, they go back to urgent care, they're not tested yet, and then the next time they make it into the ER, they are tested. But then all the people that were in the waiting room at that time, were potentially exposed to measles. So it's just interesting, kind of the burden of work and that it creates. And again, we're certainly not one of the hardest hit states. There's obviously been states that have been, a lot more have a lot more problems with measles than we have. One other thing that I think has been interesting is the state has, with their state lab, has started doing genetic sequencing, genomic sequencing, essentially looking at the DNA fingerprint of the virus to figure out how it's connected to other cases. And essentially what that showed is that it come from multiple places outside the state. So it's not like one case led to all of these cases in Washington. It's kind of, again, people flying in, people traveling, bringing measles with them. And that's something just an interesting tool that I think we have going forward that will be able to kind of track, are we seeing a lot of local spread, or is it, again, kind of these one-off travel-related infections. It also would help, tie an outbreak to another place in the state. There's just kind of interesting work that the genetic analysis can do. Let's see, I shared this graph last time, but this is the most updated one from the CDC. I don't know if my mouse is here, but last time we spoke, we were essentially in the middle of this giant spike in January of cases, and a lot of those were related to South Carolina, which thankfully has slowed quite a bit. But I will say there's still kind of sustained measles transmission as we look at the kind of tail in the graph. It's not as bad as it was in early January, but still higher than even we've seen most of last year. So just more measles around. I know we've talked about measles quite a bit, so I don't want to belabor the point, but just as a kind of ongoing public health issue that is causing some problems in Washington State, and we're trying to keep it as unproblematic as possible. But it's something we're all kind of, every county that I know of is watching and waiting for, a measles case to show up. The other thing that I wanted to touch on, because I think it's relevant, especially to Mason County, and it's relevant to a lot of things like David Wyndham has talked about in terms of trying to increase access for people who may struggle with access to healthcare due to travel or difficulty with transportation, or just it's not trying to travel 2 hours for an appointment, or the burden of trying to get lab tests done once a week or something like that. There's a interesting opportunity. So this was part of I think HR 1 that was passed last year, where $50 billion over 5 years was kind of set aside to work on rural health issues. So states could apply for that funding, and Washington just recently was notified that they received $181 million out of that $50 billion just for that first year. And it's a little bit open-ended, which can be good, and also kind of can be hard to wrap your brain around. But essentially, money that will be allocated for any sort of programs that try to address gaps in healthcare for rural areas. So we're talking about workforce issues, keeping doctors, nurses in areas, using technology to try to increase access. The different care models that exist, addressing chronic disease, both prevention as well as ongoing treatment. Any sort of programs that kind of work on these things will potentially potentially be eligible, for funding. So it's very early. Again, Washington just kind of learned. I'm still learning quite a bit about it. The state is going to have, I think, a webinar middle of next month to kind of learn more. But what I anticipate is that they will, they will use some of that money for their own programs, but then they will also open it up quite a bit to nonprofits, to hospitals, to clinics, and they'll be able to kind of potentially apply for funding. All that to say, I think there's some interesting opportunities here for public health to, at least be involved, at least help coordinate, at least notify people and educate our partners about what's available and what's coming. And I mean, for all of you on the Board of Health, if you have kind of ideas or you know of programs or you know of people that have ideas for programs that could use funding that focus on these things, I think, we want to just raise awareness about that upcoming opportunity. I think that's all I have today. I'm happy to answer questions. I'm available via email. Good to see you all.
All right, any questions for Dr. Greger? Thank you, Doctor.
I have a question.
Oh,
Do we know when that meeting is next month?
Yes, let me find the exact date for you. I want to say it's like April 15th, but I will get the exact date. I'll put it in the chat.
Tax day.
I thought it was like April 25, but
Is that something that we can find more info on online or something?
Yes, if you search for Department of Health Rural Health Initiative, it will come up in Google. But I can also kind of put some links in the chat so that people you can find them.
Thank you.
so the primary agency is the Healthcare Authority. So that would be the first place I would go.
Okay.
all right, any other questions?
Yeah,
Yes.
of those 5 gaps, what do you think are the most important for Mason County?
Well, that's a great question. I've heard different things, in different conversations with different people, so I think it kind of depends on who you talk to. I do think workforce is kind of always an issue, almost everywhere in rural areas, so just keeping, qualified professionals around and stable. I think some programs that focus on that will, cover loans or cover some funding for like a year or two, but then sometimes people will leave, which, obviously they have the right to do, but I'm curious if there are kind of ways to, keep people in places the longer term. I think that's better for patients overall. That's just one area. I think there's I don't know if this is as much of a gap as like an opportunity, but just ways to explore technology with telehealth. And we have, obviously it's hard to replace like an in-person visit, but there's a lot of things that a specialist can do for someone, talking over a video and having access to all the records and scans and that sort of thing, that could really, it saves someone a huge trip that might be a huge burden. So I think those sort of opportunities stand out to me.
And then one last follow-up, 181 million was earmarked for the state of Washington. Who were the big recipients of that money?
Well, that's to be seen.
Oh, it's to be seen.
Yeah, that's the whole, that's, I think, what, so right now, it's, Healthcare Authority and Department of Health kind of
Right.
have that money, and then how it's used is up in the air right now. Yeah.
But it comes with brackets on it.
Okay.
So the brackets say that it can't be used to supplant programs that are going away or risk funding or whatever. It can't be used for that. It has to be used to expand access, expand programs, and specifically in the rural areas. So that's where Healthcare Authority is doing the webinar. How do we define that so we don't violate the federal rule and yet provide more service? So well, more to follow on that. That's a top of our follow list.
Thank you.
All right, any other questions for Dr. Krager? All right, moving on, we have administration reports from Dave Wyndham.
Okay, a couple quick items. Quick but not small. So, as background, Foundation of Public Health Services money, FPHS, we've been working with since we got it passed into law in 2019, when I was chair of the FPHS committee. And each year, the legislature has put funding in that. A couple of years ago, they tagged some of that funding to the vape account. So the vape taxes would pay for some of that funding. Last year, in the legislative session, they moved a lot of the products from vape to tobacco, which left a hole this year of $4 million in the vape account, and next year it'll be a $21 million hole in the vape account. So what does that mean for us locally? So $4 million is going to be, $2 million is going to be picked up with unused spending. It's going to be just reallocated into that. So last summer they took $500,000 from us that goes into that pot. So we had $500,000 of unspent funds, primarily due to staffing issues. So they took that, and they did that all across the state. So we're going to be about $2 million of cut between now and June 30. Half that will be picked up probably by DOH and other entities. So you've got DOH, State Board of Health, and tribes. So tribes and State Board of Health are probably going to have no cuts. So they've been set aside. So it'll be local health jurisdictions plus DOH. So figure LHJ is going to take about $1 million hit between now and June 30. So that's not going to be that huge a hit. Where it does hit us, though, is on July 1st, that $21 million will be about a $10 million cut to local public health. And the numbers we ran last night into this morning, this is like our 19th run at this, trying to figure out a budget. Looks like about a $260,000 to $275,000 cut for Mason County Public Health.
How much?
It's $260,000 to $275,000 in FPHS funding. Still up in the air. So I'm on the committee that's working on that. What we're trying to do is establish a base for every health jurisdiction, whether it's Lincoln with 6 employees or every health jurisdiction will get a base amount, and then there will be money added to that based upon a formula. And that's where the big rub comes, because some large jurisdictions want it really around population based, $2.72 per person added to their fund. Others are like, we have huge areas to cover with very few people, so let's take that into account. So it's still up in the air and will be probably for a while. But I'm estimating we're probably going to take about Mason County sits in the middle. We're like a pivot point. So none of the plans really change our dollar amount that much because of the way it's set. So I'm guessing, like I said, 260 to 275. But we'll do with that, it's going to depend. The legislature did not fix the vape account, so I'm not holding out any great hopes there. So the question is going to be, we'll be talking about this between now and then, do we take the hit and cut people, or do we use reserves to coast the first of the year and then see what happens? So right now, our federal funding is fine, other state funding is fine. It's just that FPHS account, which for us last year was $2.2 million. Now we're down to $1.75 million, and we may drop below $1.5 million as we go into July. So, and if it funds all the things that so for example, environmental health. A lot of environmental health is paid for by FPHS funding. So a lot of the shellfish programs, a lot of the programs there are paid for. You've got Life Course, which is basically anything, across the span of life, kids to adults, that kind of work. It helps with some of our immunization, not the immunizations themselves, but the immunization education, a lot of public health education, communication, all that stuff is paid for by FPHS. So it has brackets around all those funds. My concern is that they'll keep the brackets, and what I would really like them to do is to eliminate the brackets and let the smalls, mediums and smalls, have the funding in a block and allow the directors and boards of health to attribute that money to the programs that we find most important, not what a committee at the state finds most important. So that's the direction we're pushing, and I may reach out to the board to get some backing on that as we go into the process.
What do you think we might want to do that earlier rather than later? Unless
Well,
you think you actually stand a chance of doing what you're saying.
Well, it depends on what, there's several things that are going to have to happen. So the Executive Leadership Committee is the committee of all the directors and administrators. And I've been working on a new charter for ELK for the last 3 months with several partners. So we had Clark County, Lincoln County, Northeast Tri, us, and one other county, I'll think of it. Anyway, to redo that charter, to take the money decision-making authority away from WASALFA, the large organization, and concentrate that authority with the directors and administrators. So it's not being influenced by
Are you going to need
Other
their
issues.
buy-in to do that? Because I have a
We'll
hard
see.
time believing that they're going to.
We'll see. The directors and administrators
Yeah, it just doesn't work that way.
have a lot of weight, so we'll see how it works out. So right now, Commissioner, I can't give you, my crystal ball is
Do you
pretty
want a
cloudy.
letter? Now.
Yeah,
That's
not
the
right
question.
now. Let me get it focused,
Okay.
and then I can focus your efforts on where we really need to apply the pressure.
Okay.
But you realize we only meet every 2 months.
Yeah.
But I can
So-
send something out to get, I can send a letter out, we can do, we
So
can do a special meeting if we need to.
probably should, okay that now.
That's what I'm
Right,
thinking,
that's what
yeah.
I'm thinking too.
And then you can send it
If
out. to
needed.
us.
Okay, all right.
Who's the
Right.
vice chair? You the vice chair this year?
Yeah.
So we could put it together with the, everybody look at it, but have the final verification through the chair and vice chair before sending it out.
Okay, sounds good.
Go ahead and make a motion, I'll.
You made the motion, I'll second.
Okay. Put together, I move we put together a letter to back up the request for funding and how it should be funded for our director. But before the final approval letter, it gets approved by the chair and the vice chair before being submitted.
So that's the motion? And now a second?
Yes.
And what he said, because that was way long. We got that on record, right? All right, motion and a second. All in favor, say aye.
Aye.
Opposed?
And that's what you're covering, because I don't,
Motion
carries.
I agree with you, I don't know how
Yeah,
you're
we
gonna pull
only
it
meet
together.
every 2 months. I don't wanna wait
Right.
till the last
Yeah.
minute
Okay.
and not have
Well,
it.
we can do that, for sure.
Question, I had a question. So what's the funding left over after the 275 cut? That's one. And is the cut in staff, is that this board's decision or the Board of County Commissioners' decision?
It'd be my
It
decision.
would be his, because
Your
he
decision,
heads
okay.
the
Right,
public
Okay.
health.
yeah.
Yeah.
Got it.
So, and I have to balance, you know, who can I pay for with some federal money? Can I pay for it with some county money? I have to balance all those things,
Okay.
so.
So, and then what's the fund other than the 275 cut?
So that'll be about 1.5.
Okay.
So, which is better, but we used to get 0
Okay.
6 years ago. So this is way better than it was.
Okay.
So this is
But
not
we
a
still
crisis.
need employees.
We still need employees, right. And there's some important work to be done. And I will get you a list of the kind of a chart of accounts so you can see what's being funded with what kind of money. So it all depends on the color of money. And you've said that before many times. It depends on the color of money. So I'll get that out to everybody. The other item I had was our health officer contract, which we did in January, went up to the state and they declined to sign it because they let go their 3 health officers that were doing backup health officer work. So Dr. Krager and I are going to work together and find another willing partner and rewrite the contract.
Oh
So,
my goodness.
right now we're just
I'll ask Dr. Wesson if he's got that certification you were talking about. Okay.
So we're just kind of working on that internally, and we'll get that back out. So, and that's all I have for now.
All right, any questions for Dave? Anybody online have questions for Dave? See no one. All right, environmental health, Ian Tracy.
So yeah, I don't mean to be rude, but I'll be walking out in the middle of the presentation.
No problem.
I'm sure you got like 5 minutes left.
Before I jump into my report, there's one thing I wanted to bring up is, at our meetings, it seems like we've had a lot of public interested in the meetings, and the public comment period at the end. which makes it hard for them to comment on things on the agenda. I didn't know if you wanted to consider changing the agenda order for future meetings to accommodate that.
I think that'd be a wise move, so they could comment, and we can, because it's kind of hard to take it into account when it happens after we've had our votes.
Yeah,
But I'm sure it was created that way years ago to stop things that were unruly, just don't get unruly.
Are any of these action items right now?
yes.
Okay, so-
Many are action items.
So maybe today we ask for public comment on the action items? That-
Yeah.
So we could do that
When they come up.
when they come up, okay. And then next time we'll move up comment period.
Okay, so first up, I have the report for this month. Didn't know if anyone had any specific questions on that. All right. In that case, I will, well, there's one thing I do want to highlight really fast, is just that Keith Fuller has resigned from OSAC. Keith is a major loss to that group. He's really, really great to work with. Just very grounded, down to earth,
You have
great engagement and discussion.
3 vacancies.
Yeah, we have 3 vacancies now. So,
So, did we ask Keith if he had
Keith,
a suggestion?
yeah, Keith said that he would look at the Realtors Association and advertise our need to them to try to help us get someone else. So,
That'd be great.
yeah, Keith is great even on the way out.
Yeah, he's a good guy.
So yeah, that's the main thing I wanted to highlight. Next item on the agenda is code enforcement. So last time we met, the board had voted to create a subcommittee on code enforcement. But shortly after that meeting, the Board of County Commissioners assembled a code enforcement coalition, and we had our first meeting on March 16th. There's a lot of overlap in what the two groups intended to do. I didn't know if the Board of Health still wanted to have their code enforcement subcommittee, or just see where the code enforcement coalition goes.
Okay.
Yeah, personally, I think you already created it, don't change it and find out if there's two values that we pull together. If not, after 6 months or so, then maybe have that discussion, but let's see how it all goes first.
Well, and I also think that it already overlaps. So we've got committee members that are on the Board of Health on that task force,
Mhm.
so I'd like to see how the task force goes first, and then just see if we need to bump it up or whatever.
Okay. Sounds good. Next item is Group B. So this is an item that does have, it is an action item. I guess I can introduce it and where we are, and then we can just really want to put public comment in. So just for background, Mason County regulates Group B public water systems. Within the public water system framework, there's basically 2. There are Group A systems, which are very large systems like the City of Shelton water system. Then there's Group B systems, which are smaller systems, typically regulate 9 connections or less. There's also a subcategory within Group B, just from a regulatory standpoint, which are 2-party wells. Anything over 1 connection is a public water system technically, and we've decided to regulate at a lower level 2-party wells. So this regulation that we have currently in Mason County encompasses both of those, and the regulation we have for Group B wells was very out of date, had a lot of very out of date code references, was inconsistent with the state regulations, and so we did a major overhaul to the regulation to bring it up to current day standards. So there are some major standouts or notable changes. One is that we are going to require regular water quality monitoring. In 2016, the state deregulated Group Bs and removed the regular sampling requirement for Group Bs. And it's not really gone well. There's a lot of Group Bs out there that were not well maintained to begin with, and now there's literally nothing saying they have to ever sample or look at water quality and make sure there's not bacterial contamination. So we are proposing to add our own requirement for that, with a timeline for that.
What did they do before? How often was the state require?
I don't remember that off the top of my head. I have to look that up.
As I recall, Group A's were monthly, Group B's were yearly, right?
It could be, I can't remember.
I think so.
That's kind of what I was thinking about.
Yeah.
So this is a proposed schedule that we have based on what other jurisdictions are doing, and based on feedback from the State Department of Health. And then the next notable change we have is allowing two-party water systems to develop on non-contiguous lots. So before, if you were gonna have a two-party water system, it would have to be, two lots had to be touching each other. And that was a restriction that is, that we're proposing to change that because it's a development need that we could use in the county, and it still meets the public health goal. And the public health goal is to reduce the number of straws we're putting down to the aquifer, essentially. The less holes we're putting into the aquifer, the less point, or the less opportunities for contamination that exist. So encouraging two parties is better than individual wells. And we account for the maintenance and ongoing use of that well by requiring easements for the properties that would be in between those non-contiguous lots if they're non-contiguous. Most of our applications are on either contiguous lots or the same lot where there's multiple houses on the same property.
How common is that?
Two-party wells?
Yeah.
Oh, very common. We have many applications every year. I could get you an exact number.
How many non-contiguous do you think?
Non-contiguous, a handful a year. They're not super common.
But I have a feeling if we, by doing this, this will increase that, we'll be seeing them at our level, most likely, because it's gonna be easier to probably go through the county on a county right away than it would be to go through somebody's property.
It's possible. And yeah,
Do you
they're
have
that
do
kinda
you have a
makes
limit
sense, too.
on how far?
we don't have a limit on how far. If someone can put in, has the money to put in the infrastructure, they
I
probably
was
have to.
gonna say it might be cost prohibitive
Yeah.
to go
Yeah.
very far.
Well, I can imagine there's probably some risk though about traveling 6 or 7 parcels away. Cheap enough to do it just with
From
water
a-
pipe, but that could be, that's more chance of breakage, contamination, and a bunch of other stuff.
From most water leak issues, because it's a pressurized line, it's something you find out real soon about. It's not something, if someone was proposing, a more risky situation would be if someone was proposing to have like a atmospheric lift station where they're pumping up to an atmospheric holding tank of some kind and then pumping again. And we don't allow that for two parties. It would have to be something that can be obtained just with a single pipe. So there's definitely, the longer a pipe is, there's definitely more risk for breakage and issues like that. But typically with a pressure line, you know about it. It doesn't just, hang out slowly leaking forever, most of the time. But yes, that is a consideration.
Would there be like a shared maintenance cost between those parcel owners? What if one moved, somebody else bought the house and didn't want to share his water with the guy down the
That's
street?
usually goes along with the real estate.
Okay,
It'll
there's like a
be-
deed
yeah.
restriction or whatever?
It'll be
Okay.
part of that, but when you start doing, that's one of my concerns, when you start doing it on the road though, and they come to us, we're not privy to stuff like that. And for the public, as I see the squinted eyes, currently right now, if somebody wants to do a septic on the other side of the road, we give permission to go underneath our roads. If they're gonna start being able to go 4 or 5 lots down, most likely, they're not gonna try and go underneath these neighbors' lots, they're gonna come to us to try and bring it down the road. And with that comes some more things that we haven't looked at for risks and stuff like that. But I think it'll be more normal. When I first was a commissioner, we hardly ever saw the septics going across the road. Now we get them regularly. So
Yeah,
I have to leave, sorry.
thank you.
Did you want to hear us?
No, they're for me, for later on. I'll probably call Ian. Thank you.
All right. So that's the non-contiguous lots. Any other questions on non-contiguous lots? Okay. The third item that's a standout is requiring maintenance agreements for two-party water systems. Before, we didn't have any kind of maintenance agreement requirement. So we're proposing to require that. And then the next one is establishing permit expiration dates. Before, we would have someone apply and then the application would sit there forever, 5, 10 years, and then they would suddenly come and say, I'm ready to do it now, and then, the money's gone for that application, and it's a challenging thing,
And
so.
the codes may have changed.
The codes change, absolutely. And then the final item is removing the water system designer certification program. So this is a program where Mason County used to certify water system designers. We had an exam and a training course and all of that, and that's been gone for decades and decades. We haven't had that program in a very long time. And the state requirements have changed to basically require an engineer to do it. In most cases, they do still have a little carve out for people that have been in the industry a long time. But we're basically, we just follow what the state requires when it comes to that. We don't try to have our own special separate thing because we really can't. So those are the main standout changes.
All right. Anybody have more questions? Is there anybody that would like to make public comment on the Group B regulations and policy update only? Okay, come on up, direct your comments to the board, please.
Sure. My name is Ryan Finn, and predominantly I just wanted to thank all of you and Ms. Trask regarding the committee that you formed. I think that's a good idea. But about the Group B, I had sent an email over. I know it's long, so I just wanted to summarize it quickly. In your requirements for the thing that you record when there's a two-party, well, add the word replacement. I explained in the email what happened on my lot. We got into a legal battle over whether replacement of a well was covered. It isn't. So under the current wording that says maintenance of a well, if the well fails or is contaminated, the two-party system dies. And if the property has been, let's say, lived in for 40 years, and the only access to a well site was through this easement that was created, my property in particular was in that situation, it would have been left waterless with no access to a place to drill a new well that was 100 feet from the septic. Luckily, this was all resolved, but the simple inclusion of the word maintenance and or replacement would have solved all that. So there may be other lots in the same situation. It seems like a quick fix.
Can you tell me where that section is, just real quick?
The section about maintenance and replacement, it was in Mr. Tracy's recommendations for modifying the Group B and the two-party requirements. It says to require a recorded easement and maintenance agreement. And then there were a limited number of bullet points for requirements. And one was that there be a provision for ongoing maintenance of the well. And it turns out, when it went through the legal process, maintenance does not include replacement unless the well is drilled in the exact same location.
Okay. I'm just looking for it in here so that if we do make an amendment, we're gonna.
So there's number 3 under filing requirements.
Section 3.
Under what number? 6.6?
This would be, well, this is not in the regulation part, this is
Oh.
in the design guidelines.
Oh, okay.
No page that's on.
My apologies, I would have had it right.
That's
there.
okay,
Didn't-
no worries.
It is
I always like to pick
page
apart.
11 of the design guidelines, but it would be page 21 of the Group B manual. It says filing requirements, number 3, as A, if both connections are on the same parcel as the well, the notice to future property owners of private systems is required. B, if connections or wells are on separate parcels, a water use agreement, access easements for all impacted properties, and a notice of future property owners of private two-party water system are required. The water use agreement must address each party's responsibility for ongoing maintenance of the system, sampling, and financial obligations. So I think that's a section where.
Correct. If it said and/or replacement, it would cover, in my case, there was a 20 by 20 box for well placement. They created that easement after the well was dug. The well is in the extreme corner, so clearly the intent was for future wells. Why else would you create a 400 square foot box with the well in the corner? And then a long 152-foot easement to reach it from the road. On my side of the parcel, there's a slope. Well, drilling trucks can't get by, and once the house was built, they could only get by if we demolished the home.
Okay. Or a buffer, or 3
I might,
minutes?
yep.
We've got your point.
Thank you.
I don't have a problem with it if staff doesn't have a problem with it, but. I
What's
don't
your
know.
recommendation?
So there's a couple things on this. When it comes to the easement agreement, we don't micromanage what people have in it. This maintenance agreement is something we've added to just say they have to address it, but we don't have attorney staff to review these to make sure they have legal sufficiency to meet the needs of the parties that are applying for the well. And we don't have attorneys to review it to make sure that it meets that. We make sure that they have to mention it to some extent in there, but it's really hard for us to say it needs to have this thing because this one thing might happen in the future. They could have a really terrible agreement that they draft, and we always recommend they speak to an attorney to have it drafted in a way that's gonna protect them and their future property liability.
But it wouldn't hurt to put and/or replacement in
It's
there,
not gonna hurt to put that in there,
but
but
it may not fix the situation.
it's not gonna fix the situation, because we're not gonna make sure that they are covering things from a legal standpoint. The other point I'd like to make here is that for the situation that Dr. Finn mentioned, we would require a new permit to drill a well for a two-party, because from our standpoint, the well is the two-party water system. And if the well failed, they would have to apply for a new two-party well and design a new two-party water system, because they have to meet many criteria for that to be considered sufficient. They have to meet all the setbacks, they have to meet the minimum volume production by the well. There are a lot of wells that get drilled that can't meet the minimum quantity of water supply. So it wouldn't be a situation where, it's not like replacing a pressure tank or a water line or something like that. It's literally the source of water. We would have to approve the new source of water where that would be. In his situation, it would be more cut and dry because there's an access easement specifically for that, so it's not gonna be anywhere on the property, but in most of our applications, that well could be anywhere. It could be across the street, it could be around the corner, it could be, down in a ravine, it could be many, many places. It could be really far away from the system, and we would have to do a full design review for that application to approve the new two-party.
Yeah, I think it's more about financial between two parties. Even if you put an and/or replacement, it's not enforceable by the county, it gives the novice person building a house, hey, I should make sure that I put this in my contract. It's kind of like, they don't.
A trigger.
Yeah, a trigger that this should be looked at. I mean, even though it's not enforceable by the county, we could even put that. I mean, but a party should make sure that, that it's and a replacement. To me, I mean, it makes sense to me, because I could see a cruddy neighbor saying, well, you're not gonna pay for half, I'm not gonna give you water, or, I don't know. That, or vice versa.
Yeah.
We also don't have the authority to require that agreement continue beyond the life of that well. I could see how maybe that would be, us requiring that could be insinuating that this is in perpetuity. But if the well fails, they could say, we're not doing this again, we're done with this. We wouldn't be able to force that owner to do that. Maybe a legal agreement could, but I could see how it'd be perceived as we're trying to force a replacement option in the future too by having that requirement.
Have you looked at peer counties and see what they've done? This isn't, Mason County is the first thing to go through this, but like Lewis and Callum and, have we reached out to any of those? They've figured some of this stuff out.
Yeah, and they all have very different programs. It's all over the place. Which aspect are you referring to when you're
Well,
asking?
I'm talking about this maintenance agreement and replacement.
It's all over the place. There are some that have really stringent details. There are some that don't regulate this at all. There are some that have operating permits for these systems, where you have to get an annual operating permit.
I think there's some of those elements, there's best practices that perhaps you could pull to create Mason County specific,
It's one of those things where a county has to decide how much they want to regulate something, how much resources and investment they want to put into something. Right now, we have a minimal investment system where we permit the construction and creation of Group B water systems, including two parties. and we don't do any ongoing oversight of them. They're kind of, they're created and then they go off into the world without our, our guiding touch. And that's very common in most counties. Some counties have, like I said, the licensing and permitting program where they make sure that the system is being maintained properly. You have to have a company that maintains it for you. It runs the gamut. And the more we require, the higher the cost to create this infrastructure is going to be. The more requirements we have, so we have to balance that.
Very good.
I'm okay not adding extra language as long as we, it's sometimes good to alert, but then we don't want to be liable also.
Well, we have, farther down that session, we say, refer to the Washington Department of Health guidelines for Group B public water system approval appendices for important considerations when establishing a water use agreement. So that's a guidance document published by the State Department of Health that says, here are important considerations you should, think about. And we also have some people that say, what's a good agreement that someone else has drafted and recorded. We'll give them some examples with recent applications that were approved, so they can see, what agreements look like. We can't say whether they're truly good or not because we're not attorneys. We can't
No, it should be.
assess it, but we can say, here are some agreements that seem thorough,
Okay.
and you could use as an example.
If there was a dispute between two property owners, could the property owner that is sharing the well actually just dig their own well if there was a dispute?
That's gonna depend on many things on that property. They're gonna have to meet setbacks. They're going to have to make sure that they're not getting in trouble with, water rights. A lot of the RIA restrictions.
Rider
right.
restrictions, yeah.
Mhm.
So the RIA restrictions is water resource inventory areas. So we have RIA 14, 15, 22, and 23 in Mason County. And each one has a separate set of regulations, requirements, registered ecology. So all those have to be looked at anytime they do a development.
We've been ignoring Zoom. Anybody on Zoom have anything? Pat? No. Anybody else?
Snea is one of ours.
Huh?
Snea Gunda is one of our board members
Yes, sir, Mr.
from.
Well,
Ms.
Ms. Gunda, you have any comments or questions? Guess not, all right. So, is there any other questions? Then, is there a motion to approve the Group B regulations and policy update?
So moved.
Second.
There's a motion and a second to approve the Group B regulation and policy update. All in favor say aye.
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 Opposed? Motion carries. All right, we have an on-site standards update also. Ian Tracy.
All right, so. So our on-site sewage advisory committee had back in December approved or voted to recommend a change to the on-site septic standards. And I brought that before the board back on January 27th. We discussed it and the board decided to send that back to the on-site sewage advisory committee. The on-site sewage advisory committee reconsidered and they changed their recommendation to recommend the language shown here, which would change it from just banning drain field reductions entirely to allowing the drain field reductions in limited circumstances for repairs only. So that was, I believe that was a unanimous vote. But that's their recommendation that they're bringing back before the board.
So you just need us to either accept their language.
Yeah, you can accept the language, or you can change the language and hope you do anything, or you can deny the request.
really good. So the only change would be the green pill rejection may be allowed for repairs on a case-by-case basis using products approved by the Washington State Department of Health.
Yep.
I would make that motion.
And I'll
Is there-
second that.
Well, is there anybody who wants to talk on on-site standards updates since it's before public comment? All right. So I heard a motion and a second to approve the on-site standard update language. All in favor, say aye. Aye. Opposed? That motion carries. All right, Ian, I think you're off the hook unless you have anything else for us.
I think that's it.
Anybody have any questions for Ian?
Oh, let me think.
All right, other business, community health report from Melissa Casey. Just tell me what
Good
we have to look.
afternoon now, almost. First item I have is I actually have a pretty serious typo in my report that I'd like to correct. So where we've reported our syndemic clinical services, I'd love to say that we did 6,000, third page? Third page. 6,732 engagements. It's really only 67. So this is.
And I didn't even notice that.
I caught it and it was too late to fix it before it went out in the packet, so I just noted it here. Especially for our newer board members, this is referring to, we provide syringe exchange services on our mobile unit, but we contract with North Mason Regional Fire Authority's mobile integrated health team to do the clinical services. So this is really surrounding infectious disease testing, getting people started on treatment. It also includes Hep C, so STIs and Hep C, and also providing linkages to other types of services that they need, whether it's counseling, treatment, our LEAD program, our law enforcement assisted diversion program, wound care, psych appointments, those types of things. So that's a correction on that. A couple of other things that I wanted to highlight is, I think many of you know that Ben Johnson, after 25 years with public health, has retired. We have heard loud and clear just the feedback on how great the Substance Abuse Prevention Coalition has been. We are continuing that. Funding is going to be a little bit different for that. So rather than having a full-time coordinator, we actually have Monty Arnold, who I think he's on the call. He is one of our community health specialists who he kind of works blended. He primarily works as the lead project manager, law enforcement assisted diversion program. Also outreach for our syringe exchange program. He's going to do a small percentage of time coordinating the Substance Abuse Prevention Coalition so that we still have a coordinated effort. But I think when it comes to doing a lot of the projects that have been done, we're really going to lean a little bit more on our community partnerships to make some of those things happen. Just because we have less funding and less time dedicated to it. But we're excited that we can keep that going without having to stop all the really great work and the path that Ben has paved for us on a lot of that policy work.
We had our first meeting with Monty and it went quite well. Thank you, Monty. We had lots of good ideas for the next year. So.
Thank you. Eric has been really consistently involved in that, so we appreciate the support. Another item that I'm really excited to kind of highlight is we're going to have a little bit of a busy summer. We have our next, not my page, it's our third annual Bike Rodeo and Safety Day. And it's one of the things that I'm really excited about because it has really been a beautiful example of what community partnerships look like. It's really not costed us that much. A lot of agencies have donated their time, the supplies that we have. So a lot of the partners we've worked with is law enforcement. We've had consistent participation from Shelton Police Department and the Mason County Sheriff's Office. Central Mason Fire, Mason Health has a booth every year. And it's
Life Flight was there.
Life Flight. We had a helicopter last year. You'd think we'd never seen a helicopter by how excited we were. But it's just a really great place to provide some injury prevention education and a great place for a lot of the tools that maybe a lot of families might not have access to. We've been able to give out bicycle helmets to those who are in need. The sheriff's office deputy Matt comes with the boat, and we've been able to give out life jackets to families. Seattle Children's will be here this year, giving out firearm lockboxes and doing a little bit of education on that. And I think the Substance Abuse Prevention Coalition will also have ice cream again this year. I'm not sure, are you planning on, you know? I think so.
I think that we talked about ice cream, did we
Yeah,
talk?
yeah. So,
We talked about a lot,
Sounds like you're committed now.
we talked about a lot of programs.
It's a great little treat for the kids. So people are welcome to bring their bikes and their scooters, but of course we know that many people may not have them, or they may not have a way to transport them. So we've built up a really great inventory of supplies that we can loan to families. And the last thing would be if anybody's interested in volunteering, we could definitely use the hands. We've got an obstacle course to help kind of teach the kids rules of the road.
Yeah, I was gonna say, what day is it?
Oh, sorry, I thought I said Saturday, June 27th. And it's really, it's a great central location at Olympic Middle School. So it's right across the street from our office. It's been helpful for coming back to the office. If we need to get more supplies, they go pretty quickly. And it's from 11 a.m. to 3 p.m. So hoping that we don't get rain this year. Last year, it rained while we were setting up, but we had blue skies the rest of the day, so.
Can you send us an email and ask who would like to volunteer?
I could do that. We've got the flyers actually just completed yesterday, ready to go. And then finally, one thing that isn't on the report, that's kind of been a little bit of a new development this week is we have had some notifications for pertussis, whooping cough. We've got a great,
In our area.
have you seen a lot?
There was a whole family that, yeah.
Probably the same one. But we have a great communicable disease nurse. She's already been in touch with the family, and I think everyone is on antibiotics. That's the first line of treatment. Isolating for 5 days while they're on treatment, and doing some contact tracing to see if there may be other cases that we're expecting coming up. But we'll probably have our health educator do some general education on that going forward. But we will keep you apprised.
Would you guys be interested in coming into one of the commission meetings so that we can make sure that other people know what the steps are?
We can do that.
Vaccination
Mm-hmm.
ahead of time. Tdap.
Tdap, exactly. We actually, speaking of vaccinations, we also have a vaccine clinic coming up at Faith Lutheran Church on April 14th, from 3 to 7 p.m. Dave mentioned funding a little bit earlier. It's kind of dwindled over the years. We used to have the DOH caravan. They'd come and bring their van and they do the vaccinations. Unfortunately, they also have experienced funding reduction. So we've been able to partner with a medical clinic to do these vaccines. And Faith Lutheran Church has been a really great partner for providing the space. There's also they have a lot of access to some of the populations that may not be insured, or there may be some language barriers, so they've been able to help us can reach those populations, get them vaccinated. We've also worked in partnership with the school districts because they are also starting to really enforce the being up to date on the vaccines. So we're working with them to identify if we need to do other pop-up clinics to help them with the compliance on that. But that is coming up on the 14th, and everything else, which has been business as usual. WIC is highlighted. We've had a staffing shortage, but we've also had our largest caseloads during that time. So we're really excited, and I only have big kudos for our team.
What is our vaccination rate for like Tdap and some of the major?
We've had, I think since COVID, we've experienced a really low vaccination rates. I think that there's been an increase in the hesitancy. Percentages, I don't have it at the top of my head, but we were not very compliant.
You're less than 90%.
Less than 90%, definitely. I want to say it was 75. in the 70% range. But it has been increasing as we've done more education, and we work in partnership. Elizabeth Custis is our maternal child health nurse, and she also works in the immunization improvement programs, and we have really great line of communication with the Mason Health Pediatrics Department, and so they've communicated with us what they're seeing, so that we can help with providing some education.
And the schools have been trying to keep up with that also.
They have been,
That,
right?
I know that I've had several referrals from the school that said, well, I can't go back to school till.
Yep.
And we do have we purchased a 2 exam room van because Caravan was going away. It should be coming out of the paint shop soon, and I felt where I talked to Eric Mull about if the hospital, has a use for it, it's there for that as well. So when the hospital wants to be doing projects out in the community, we've got the vehicle for them to use.
Eric's out of town this week.
Are there any questions about?
I was gonna ask, is this the final point in time count now?
No, thank you,
Okay.
Eric. I'm glad that you asked that. What you have for the housing data, this is a preliminary count of the point in time count that we had at the end of January. The final counts don't typically come out until about June, at which point we will publish that as well. But there's a little bit of deduplication and some things that need to happen for that. But it should be within range.
All right. Any questions from Melissa? All right, moving on. And other business and board discussions. Anybody have any other business?
2 very quick things. The county health rankings are no longer. So Robert Wood Johnson Foundation, who funded those, no longer funding them, so they're not doing the county health rankings. So those go away as of this year.
So we don't have to compare ourselves.
Right, right. And in the last
They
couple,
made such good improvement, though.
yeah, and in the last couple of years, they changed the way they did it, so you couldn't actually see where you improved or not because they made circles. And
Yeah.
so that's off. And our pilot program on mental health is ending. And we partnered with United We Care. They initially agreed to do 90 days. They did a year. And we learned a lot of things. We had I think we had 2,400 people sign up. Our goal was 25. We kind of hit a saturation point, I think, in the fall. We've had over 400 assessments. People who got online and did assessments. Many of them did multiple assessments of their own mental health. So for those of you who don't know, it was an AI program, but it also connected you with live counselors, therapists, and so it was a hybrid model. So many of them are just the AI. This was hybrid. We had 67 clients connected with therapists. Yeah, and I said over 400 did assessments. I think it was like 427. We learned a lot about how to reach the community. So we did newspaper ads, and we did radio ads, and we did mailers. And what we found out were those were great for getting information out, but nobody would actually click the button and sign up. So we had handfuls of those. As soon as we went to online marketing, we had 50 the first day, 75 the next day, and it just expanded. And I think by the end, I think we had 4 or 6 suicide interventions through the program. So it's, we learned a lot. I think we made an impact. So now the big question is, what do we do next? And I don't have an answer yet.
What was
So-
the program? Sorry.
It was a pilot program with United We Care. There was an AI and so it was virtual and therapist connected program.
I checked it out.
It was very
It
cool.
asked me every day how I was doing, if I was doing better. I said, I told I was being bullied or something.
Yeah.
and
Yeah,
It asked me every day if I was doing better and if I needed to talk to anybody. And so
Yeah.
it was pretty
Well, I
pretty
think in
interesting.
rural counties is really
Yeah,
a very
yeah,
important thing.
it was interesting. I put in like a typical day, and it's first thing he says, "Would you like to talk to somebody?"
You said that went on it was supposed to go for 3 months and went on for a year.
For a year, yeah.
And is it a is it a per encounter, or is it just a set?
We
fee?
paid for it with funding from the county, so we just paid a block.
Okay.
So the next thing is, so if it works, then how do you fund it ongoing? Do we fund it, on a charge per? Do we fund it through, we're hoping to go through the rural health transformation project. That seems to be a really good outreach in rural areas where you might be able to, because a cell phone is all you need. All you need is a cell phone. And all the providers that we hired through the thing were Washington providers, so it was not out-of-state providers. And the company was very good to work with. We connected many times 5 days a week in the morning, first thing, to talk about where we're at, how do we adjust things, how do we make it more useful, more practical. So we learned a lot about how to actually reach people and get them to take an action.
So is this something that we could use the rural health initiative money if we get any for?
So we're looking at how do you do it? How do you expand that statewide?
That would be something that we need Dan, Drew, and Travis to
Yeah.
tackle.
Yeah. So, I mean, we've got.
Can you reach out to them?
I
And
can.
let them know how well it worked
worked.
here.
Right. So, yeah, we were pleased with the results. I mean, there were days where we get a little discouraged. We wouldn't see an uptake for a while, and then suddenly there'd be right after Christmas, we got a big boom.
Of course.
So, the dark holidays and that kind of stuff. So, we learned a lot. I'm very pleased with how it went.
Is there somewhere where we can access that data, or have you guys put that?
I've got a PowerPoint I can put together.
I think it would be, I know I'm not part of the board, but I think it would be good for the community.
Yeah, shoot me an email. I'll get it for you.
Are you doing that tomorrow on the advisory board meeting?
Okay, yes, I am.
Yeah, it's on,
Yeah.
the meeting tomorrow.
Yes.
Yeah, you'll be.
Well, there you go. See how fast he is?
So that was my 2 alibis.
All right. Pat, you have anything for new discussion or new business? All right. Anybody else? Oh, go ahead.
He said nope.
Oh, anybody else? I sent out a letter to everybody about Kratom. I've been working on Kratom for about 3 years. We finally had, I think because of Mason County, and Ben will probably even confirm it if you asked him, I think that we were a big part of having 3 bills in legislation this year on Kratom. None of the Kratom bills advanced, but they had strong support until some of the big boys came out and testified, against it. So,
Sometimes it takes 3 sessions
Yeah.
for it to become.
but it was pretty. I testified multiple times on multiple boards or committees, and it seemed that it had some strong support. So I was looking at maybe either moratorium in Mason County or banning it. Age restriction is where I would like to go, but I think that's going to be, we can't enforce that. How are we going to enforce age restriction on something that, or cops are going to go in and stand and watch somebody buy Kratom? Probably not. So I think a moratorium or a ban would be sufficient. Multiple cities and counties are doing it right now. Quiellum is doing it, Spokane Valley, I believe Seattle is looking at it, and it's pretty dangerous. It's a plant out of Southeast Asia, and it seems to have some benefits to some people, but it's addicting. People have committed suicide with it. People have been addicted. Kids are having issues. We've had an overdose and a death here in Mason County. So I would like to ban it Mason county-wide for now and see what the state does next session or the session after that. But that's.
How are you gonna enforce that?
Well, when you ban it, you ban it. It can't be in the stores. If you drive around town, we've got Kratom signs all over town, and out in the county too. So,
In the same way that you would do tobacco.
yeah.
So you kind of do stings and that kind of thing.
Yeah, but imagine once you ban it, and it's just not gonna be in stores, so. Obviously, they probably order it on, out of state, but, we've got 12, 16, 17-year-olds buying Kratom at our local gas stations. It's just not a good thing.
Yeah, this is something I think I'd like to bring Tim Whitehead into the conversation so that we can find out what we can and what we can't do.
Yeah, well, have them look at Spokane Valley and Quiellum and all them. They've all banned it, or some are age restricting, like I said, but we have no way. That's going to be really hard for us as a city or a county to do that. Good news this year in the session is House Bill 2532, which was the nitrous oxide, passed 95-0, I believe, and 49-0. And I don't know if the governor signed it yet. I was hoping to be there for the signature, but that's going to pull nitrous oxide out of our gas stations, the $99 tanks that you can inhale. you know, and get high on. So that'll be out in 90 days after the governor signs that bill. So we were a big part of that as well, the Mason County Substance Abuse Coalition. So it's
What was the bill number?
what's that?
What was the bill number?
House Bill 2532. I've sent emails to her or legislators, see if I could be there for the signing, but I haven't heard
And the
back.
Kratom, are the sheriff and the city police chief, are they on board with that?
Well, I would hope anybody would be on board with the substance that minors are buying and getting high on.
Will they
But-
have to enforce it?
Well, we're talking about pulling stuff out of stores. I mean, we're gonna,
Right.
I mean, it's just not gonna be there.
It's
I mean,
not there for them to
it's
buy,
not, it's
they
not
can't
for
buy
them,
it.
for them to buy, correct, yeah, so. It's pretty nasty. You should just, I mean, it's, even in its natural form, it's somewhat dangerous, but it gets worse and worse as it gets, as they 70HA, there, you know, and they synthesize it, is that what it's called? And it's pretty nasty stuff, so.
Eric, this question, you said Spokane and then like Clallam or.
In Spokane Valley, yes.
In Spokane Valley to look at. Has there been any fallout for, I see this a lot, where you do a good job of blocking this and then the manufacturer creates something a little bit different, you get the same problem in a
Always,
different package.
yeah.
And that's,
Well, I mean,
They
the kratom is a
already
plant, I
are.
mean,
Yeah.
it's.
Yeah, no, I understand
That's
that,
gonna
but-
be easy, but there's been, in the legislature, there was some bill, one of the bills was gonna focus more on the 70HA, which they were doing here, but, I haven't heard much, but it's all fairly new. Qualam did it a few months ago, Spokane Valley were waiting for the legislature, and they didn't pass it, so it's,
To be determined.
they moved forward on it too. And actually, you could just Google it, and
Yeah.
it's popping up, yeah.
Still
I heard,
the
I sat for
governor's
5 hours to testify on the Kratom bill one day, and it was interesting hearing the comments from people. There was people that said, I was on Kratom, I got addicted, I stole to get it, and, you know, and it was because I could buy it anywhere, you know, and there was people that said, oh my gosh, this is the best thing that ever happened to me, I can get out of bed. And so, but I can't buy painkillers at the Shell station, so you shouldn't be able to buy Kratom at a Shell station. It's my opinion, but.
the utility though, I've actually asked, you know, some of my peers and it was shocking to hear that people talked about success cases with it. So I worry about balancing, you know, for the good and then keeping it on the people that perhaps shouldn't have it. So I'm interested to hear what happens in those other communities.
Yeah. So, that is my new business discussion.
Pat's got that.
Pat,
So, I just wanted to comment, I spoke to Tim about that maybe 8 months ago, about Kratom and us banning it. He says that is not something, an action the county can take. The city of Shelton could ban it, but the county could not without the state taking action, so.
oh, that's shocking that the Board of Health can't protect citizens of Mason County.
Maybe, but we can't ban a product that the state says is legal. That was his take. That, I'm not quoting it directly. It was
Yeah.
maybe 8 months ago I talked to him about it. Just to give you a little heads up there.
Okay. All right, any more new discussion? All right, we're at,
Good of the order.
now we have public comment.
Good. Just real quick, my son is on
Oh.
Google. He's a PA up in Skagit. And so just wanted to say, he is getting five stars, so.
Nice.
4.8 out of 5, so just bragging.
Oh. I thought I was going out of whack. I'm going,
Yeah.
no, I'm looking at the sheet. All right, public comment. Anything that we did not discuss today on the agenda, comments are 3 minutes, and please address your comments to the board. All right.
Hello, board members, county commissioners, good morning. I think it's afternoon now. Most of you all know me. I'm Katherine Johnson, the Executive Director of the Humane Society of Mason County. I'm just here this morning to just quickly share a little bit about some of the work we're doing in the community and let you know that our 2025 impact report is now available. I did bring some copies with me. You've already sat through the spiel. It's also available on our website. So this year has been one of the most impactful years that we've had as an organization. We've helped more animals than ever before. We've expanded access to veterinary care and continued to show up when our community needs us most. But I wanted to share a little story about what that actually looks like. One of the stories in our impact report is about a dog named Dorothy. Dorothy was found by a Mason County Sheriff's deputy laying in the middle of a logging road, unable to move, with a severely broken leg. The deputy was pretty busy that day and wasn't able to stay with her, but he called us right away and we made sure to take action. We immediately sent a team member out and we were able to safely load Dorothy up and bring her back to our facility in Belfair. Dorothy's leg ultimately had to be amputated, which we were able to do at our facility in Belfair. Our staff made sure that she received all the medical care that she needed, and she was placed into a foster home to continue healing until, as she also had a broken pelvis. Today, she's no longer that dog on the side of the road. She's safe, she's healed, and she's been adopted. That story is just one example of what it means to have a local organization who can respond in real time. It's not just about adoptions, it's about emergency response, public safety, and making sure when something like that happens in Mason County, there's somewhere for an animal to go. The Humane Society of Mason County is a fully staffed animal welfare organization with a team of 14 staff members, 10 of which are full-time, and 2 licensed veterinarians, providing care right here in Mason County. We work closely with law enforcement, first responders, and community members every day. As we look ahead, we're continuing to focus on expanding life-saving care, making sure that we can say yes to more animals, more complex medical needs, and more situations like Dorothy's. I also want to invite you all to our annual event, Tales. It's on May 30th this year, and we moved it to Little Creek, so up here in Shelton this year. So thank you all for your time. I always love coming and speaking with you all.
Good timing.
Yeah, I'm going to be real quick. It's a process question. So my name's Constance Simpson, and I live in Union. So I just want to clarify what happened today and the process and goes future. So, because when I look at the authority of this board and what happens here, I have, from the website, it says that this is an advisory board. And so I assumed then that you are maybe going under this 2012 handbook for how you conduct business. I don't know. That's the only thing I got there. So today on the two-party well situation, I noted that Ian said, there would be a public comment in that time slot. That would hint that it was a public hearing. And so I'm just saying, I see Dave going like this. So what I want to, so for me, because that was, and I'm a dork about this and details of how government functions, that is a change to the sanitary code. So would require to go to the Board of County Commissioners, and it should be a public hearing, and there should be maybe an article in the newspaper, a notice in the newspaper. Maybe the commissioners will brief again, will be briefed by staff, and then there would be on the agenda, and the public could ask to have more discussion on it or something.
No, so boards of health are independent in many cases, nearly all cases, from the county commissioners.
Mm-hmm.
So it used to be that the county commissioners were the board of health. That law changed several years ago.
I know.
And now the board of health is governed under RCW 70, 050, and that gives you the authority and background for boards of health. And boards of health can make these decisions.
So what you all did today, that is going to now be the change in the sanitary code.
Mm-hmm.
Okay, so then I'm just gonna ask this kind of housekeeping detail, is that on the Board of Health webpage, then you're not up to date.
No, yeah, I brought that to our staff.
Yeah, it's been going on for a long time, so, if Pam and the new gentleman here are not on there. So, do you have a separate then, handbook of how you conduct the meetings and hearings, particularly where you're gonna make a change? Because for the public, it seems somewhat unaccountable, I'm just saying.
Boards of Health are separate, and if you
Mhm.
jump into 70, it starts at RCW 70, it goes
Mhm.
all the way through, it's a long RCW. But it outlines the authority of the Board of Health, and those things that the Board of Health is responsible for, and this falls within those.
We normally don't have a back and forth. Can we have maybe Dave get your email and maybe you guys can communicate about that, and then he can kind of inform us,
Well, I should tell you, what, next meeting, let me do a Board of Health education session. How about that?
Will it include just kind of a handbook
I'll
about
take
what's
it
an
down.
open meeting, what's open records? When a hearing happens, it just is on the agenda, that kind of situation. So the public will know when they can participate in a meaningful way.
Yep.
Can do.
Okay? Thank you.
Thank you. I missed one little comment I had. I was informed that we have a gentleman named Gary Plew on the board that's not been here for years, so we should probably go ahead and remove him and then advertise for a replacement.
And I did direct staff to take a look
Okay,
at
yeah,
that and
yeah,
update it.
yeah,
Okay.
that was already done, it's
Okay.
just still on the website.
Yeah, there's lots of errors on
Yeah.
that.
Got it.
Just not on the website.
Got it, okay. All right, if there's nothing else, do we have motion to adjourn here?
Do you have any more comment?
Oh, I'm sorry, was there any more public comment?
I'm too wet to move, so no.
Give us a little tap.
All right, is there a motion to adjourn?
So moved.
Second.
All right, motion and a second to adjourn. All in favor, say aye.
Aye.
All right.